There is a saying that tuberculosis is the best friend of any war. And Ukraine is not exception. As we are marking 2 years of the war Russia started against our country and our people, it's also time to reflect on impact on tuberculosis. With such huge move of the population, just to remind that 7 million Ukrainians left their homes because they lived on occupied territories, or their homes were destroyed, or they're afraid to stay under constant shelling. So it's a huge move of population, and of course it's impacted situation with tuberculosis, with stress, less nutrition, sometimes cold during the winter with no electricity and heating. So what we observe actually is that missed TB cases increased. So there are more undetected TB cases during the war. It's a very worrying trend, and we as civil society organizations working with the Global Fund support, applying new approaches like active TB case finding. And it demonstrated even better results than index testing or just generic screening. So in addition to the traditional group of risk, like homeless people, prisoners and ex-prisoners, Roma minority population, people who use drugs, and some other groups, we now are facing a big group of internally displaced people. Just to give you an example, spending every night in a bomb shelter with the crowded spaces in the very cold conditions, with no heating and concrete around you, with a 0 or minus temperature. All these things are not helpful for fighting tuberculosis. We work in very close contact with the government, coordinating efforts, and also even at the stage of the planning, because proposal to the Global Fund is going through multi-stakeholder discussion and approval. So it's all interventions are getting verified and supported by international partners, civil society, community, government, medical community. So this engaging process helps to focus on the things very relevant. And some new things emerging. I can just share with you one example that we did research, and 34% of TB patients with MDR TB were recorded as having depression. Before the war, we didn't pay attention to this, maybe because very minor proportion. But now it's so big issue, and we introduced, for example, this complementary treatment of mental health.
We've had the one understanding by Ukraine for the last 20 years.
Yeah.
Most recently, as of 1st of January this year, we started implementing the next grant to Ukraine. It's a 3-year grant. It's a grant with an overall allocation of 157 million for HIV and TB. It also includes additional catalytic matching funds. Some of it is for identifying missed people with TB. Some of it is for addressing human rights related barriers to HIV and TB services. This support has enabled some of those innovations that Andriy is referring to. This support has enabled healthcare providers and community workers to work together to find people where they are, to be able to provide the services and the life-saving services that they need, be it diagnosis of treatment or care and support. Because the needs are many, humanitarian needs have only amplified the challenges related to TB, as Andriy has just explained. So this is why we have been very flexible for our previous grant. Ever since the full-scale invasion has started, we have approved emergency funding to Ukraine. We have also been very flexible about reallocating funding in the previous grants to meet the amplified needs related to tuberculosis, related to HIV, related to the increased human rights related barriers that we see. The communities on the ground know best which approaches work. They know best where to find people that need the support. So this is why we are heeding to their recommendations. This is why we are supporting those community-led or community-based efforts to be able to reach the people left behind.
Consolidated efforts are very important. Working government, medical professional, civil society, and community, as well as deploying international expertise. Resources are critical because in the time of the war, there is draining of the resources. Ukraine was an exemplary country for sustainability and transition, showing commitment with procurement of medications. But when the war started, 60% of our budget is going to defense. So we are again very dependent on the international support and resources, both in treatment and prevention.
And I think that Ukraine has demonstrated incredible resilience and adaptability. They have piloted different modalities of reaching people, digital health, mobile services that are able to reach people in deoccupied territories where healthcare settings have been completely destroyed. These are models that should be taken forward. They should work not only in the context of war, let's hope that there will be no more context of war in Europe and elsewhere, but these are models that have potential to be game changers in cases of climate change and all the disruption that brings, pandemics, because we're quite certain that COVID-19 is not going to be the last pandemic. So it's about how do you approach those sustainable systems for health in a way that puts the emphasis on communities and health systems working together to put people at the center, using innovations such as those piloted in Ukraine and taking them to a larger scale and to many other contexts. Global Fund is working on its investment case for the next allocation cycle, for the next replenishment. That investment case is examining the world we live in with all the challenges on this world. We're seeing the pressure that sustainable systems of health are under. We're seeing the impact of climate change and pandemics and wars and other disruption. We're seeing a pandemic of bad laws and a pushback on human rights and gender equality that needs to be addressed. So the resource needs are many.
Global Fund is the major donor for TB response, number one. And it's proven to be effective. So it's critically important to continue this work. And as Alexandrina mentioned, the next replenishment and next investment case is a key things to continuation of this success and actually stopping TB. So in this regard, as we are in the EU Parliament, further funding from EU to the Global Fund as proven mechanism to deliver results is a very essential thing.